Rabies, there are two forms of rabies. One is furious rabies and another one is paralytic rabies. The furious rabies is 80% occurrence. The common symptoms you are going to see in case of furious rabies are hyperactivity, excitable behavior, hallucinations, and lack of coordination, and hydrophobia and aerophobia. And death occurs after a few days due to cardiorespiratory arrest. Then coming to paralytic rabies, accounts for about 20% of the total number of human cases. This form of rabies runs a less dramatic and usually longer course than the furious form. It will be for longer duration, and muscles gradually become paralyzed starting from the wound site. A coma slowly develops and eventually death occurs. Because of its paralytic form, the disease can be misdiagnosed and contributing to the underreporting of the disease. Diagnosis, as explained, there is no WHO approved diagnostic tools for detecting rabies infection before the onset of clinical disease. Clinical diagnosis of rabies is difficult without reliable history of contact with a rabid animal or specific symptoms of hydrophobia or aerophobia. So, once we are going to see the symptoms of hydrophobia or for aerophobia, then only we can confirm the case as a rabies. And accurate risk assessment is crucial for deciding on PEP administration. Once the symptoms emerge, the death is inevitable, 100% fatal, the person is going to die. So the treatment modality is offering a comprehensive and a compassionate palliative care is recommended. Postmortem confirmation of rabies infection is done by various diagnostic techniques that detect whole viruses, viral antigens, or nucleic acids in infected tissues like brain, skin, or saliva. Where possible, the biting animal should be tested. The biting animal, if it is dead, the brain, skin, or saliva of the rabid dog should be collected and it will be sent for examination or testing the rabies. Prevention, the vaccinating dogs. The prevention is the most important thing in case of rabies. So first thing we should go for mass dog vaccination, that is vaccinating the dogs. Vaccinating dogs including puppies through mass dog vaccination programs is the most cost effective strategy for preventing rabies in people because it stops the transmission at its source. So source is 99% of the transformation of the rabies is through dogs. So first preference in or preventing the disease is through dogs only or vaccinating the dogs. Then coming to awareness, public education for both the children and adults on dog behavior and bite prevention. Dog behavior and bite prevention should be given to the public, especially for children and adults. What to do if bitten or scratched by a potentially rabid animal, and responsible pet ownership are essential extensions of rabies vaccination programs. So the pet owner should take care about the vaccination thing to the puppies. And responsible pet ownership should be important. Vaccinating people. Effective vaccines are available to immunize the people both before and after the potential exposures, as listed under the WHO pre-qualification of medical products as of 2024. There are only 3 WHO pre-qualified human rabies vaccines available globally. Only 3 WHO pre-qualified human rabies vaccines are available in globally. They are, one is Rabivax S by Serum Institute of India Private Limited, Pune. Then Vaxirab N by Zydus Life Science Limited and Virorab by Sanofi Pasteur. Next slide, you are going to see the images of these vaccines. First one is Vaxirab N by Zydus Life Science Limited. You can see the image. Virorab by Sanofi Pasteur. Third one is Rabivax S by Serum Institute of India. Thank you. Please watch the